A big burden does fall on our carers. We really need to invest in those organisations that really support that care along that life course. Hi, I'm Stacey George. I'm the Professor of Healthy Ageing Support and Care and Occupational Therapy. It's a concern of the society. How do we give quality to older people as they get older? How they can maximise their ability, how they can keep doing the things they want to be able to do. We're also really interested in the support around older people. So it's available for people how they want it delivered to give them dignity and choice in how care is provided. The CFI is made up of a multidisciplinary team, so there's health economists, there's nurses, allied health, there's social scientists. So really it's around problem solving some of these tough issues in our society and bringing different ways of thinking. A big focus of the CFI is actually listening. Listening to older people, listening to those providing the services, listening to policymakers to see how we can best support our research, to look at the areas where there's gaps or look at areas where there's problems, but also when things are working well, how we can translate that across more services to provide that to more people.
I'm Sue McKechnie and I'm the Executive Manager of Community Services for Resthaven Incorporated. The commitment is to evidence-based practice and the upskilling and development of knowledge of staff, and also to support continuous improvement, which are all key ingredients in a quality aged care program.
The Eye Support Program is a World Health Organisation program. The Resthaven were pivotal in gaining participants to say, well, how do we adapt this to the Australian context and how useful is it?
The Eye Support project has been very successful in its first stages, and the further funding that has been gained to continue the Eye Support development.
The CFI really champions that older person's experience and gaining that systematically from diverse populations, then that can really inform policy, and also where policy isn't working. So then we can really advocate with our service providers around policy formation. The unique aspect of the CFI is that people feel heard and people feel like not only have they shared their experiences and thoughts and preferences, but then actions happened and then they've been involved in that translation. So I think the outcomes have really been around people feeling empowered to then advocate more as well.
A lot of the research has the potential to influence public policy in aged care, which is also important for the ongoing sustainability of aged care, and also helps to build confidence and trust in aged care services.
Our vision for CFI is around adapting as society changes and older people's experiences change, and then being able to make choices about the way they want to live and the support adapting to that. We need to value people that work in aged care, and it's bringing evidence into practice to provide the best quality of aged care.